In 2013, a collaborative study by Virginia Tech and Virginia State University showed that the effects of food deserts in Virginia were a huge health concern for a large amount of the state's citizens. These are areas in both urban and rural Virginia where residents do not have easy access to fresh, healthy, and affordable food, and it's largely due to a lack of grocery stores, farmers markets, or healthy food providers. The study, which crossed racial and economic boundaries, proved what many folks had feared. The citizens of Virginia were suffering, literally starving for healthy foods in these food deserts. But several years later, nothing much had been done to address the problem. That's why Jewel Hairston, Dean of Virginia State University's College of Agriculture, asked Emmy Award-winning filmmaker Jesse Vaughn to publicize the study's findings in a documentary, Living in a Food Desert.
Across Virginia, approximately 17.8% of the population lives in a food desert.
We're here suffering. All we ask is that you listen to us.
They should at least have one grocery store in this area that is a grocery store, not a damn junk store.
Food deserts are indeed present all over the state of Virginia. But sometimes when you have that on a piece of paper in a study, it has a tendency to potentially be put on a shelf and put away. And this is something that I think many are passionate about in the state of Virginia, not just VSU, but there's so many people who understand this is an issue right in their own community. And so now the documentary puts a face on the issue. And so if we're really going to hit this issue hard, we're going to need some focused resources towards this to incentivize stores to try to carry healthier foods. We may need some policy changes, tax incentives, and those types of things to encourage people who have an entrepreneurial mindset to try to do something different to get fresh and healthy foods to challenge communities all over the state.
Hairston herself grew up in a food desert in Petersburg and knows firsthand the problems facing people in these areas. But the problem goes well beyond central Virginia. Maureen McNamara Best, executive director for Leap for Local Food in Roanoke, says the problem's just as prevalent in southwest Virginia.
I mean, Floyd County, a lot of that is considered food desert, but that's also where most of our farmers are, and so there are different challenges because you may have land, but you may not have, you may have to drive really far to get to a full-service grocery store.
The food desert study came out of a U.S. Department of Agriculture nutritional study, and it was funded by the Virginia General Assembly. The film's goal is to enlighten Virginia communities on the growing problem and help them find local solutions that work.
We have agriculture is the #1 industry in the state of Virginia, but we have people who are hungry and we have people who can't access nutritious food. And so there's that disconnect. And I think that's what's so important. How do we begin to bring the solutions to the problem? Hopefully that will be the outcome 5 years from now. We will begin to see changes occurring and people who say, hey, you know what? There was no big grocery store that opened in my community, but now my corner store carries fresh vegetables. That's where the change really occurs at the very personal and the local level. So that's what I hope will come out of all of this.
It's easy to kind of talk about food deserts and census tracts, but it's like, what does that actually look like on the ground? And so it may be that, in one neighborhood, it's economically depressed. There's a lot of maybe minority groups living there, a lot of immigrant groups. And, so a lot of times when there aren't services available, there's a lot of services that aren't available. So food desert is just one additional struggle or barrier.
Living in a Food Desert premieres March 1st at the Byrd Theater in Richmond, Virginia as part of the Richmond International Food Festival. Reporting in Petersburg, I'm Norm Hyde.